friends, distinguished invited speakers. Good morning, good afternoon, or good evening, depending on where you are in the world right now. And welcome to this digital event, The Role of Pharmacists in Tobacco Cessation, organized by the International Pharmaceutical Federation. Next slide, please. For those of you who don't know me, my name is Lars-Åke Söderlund, and I have the honor and pleasure of moderating this event today. I am one of the FIP's vice presidents and also co-chair of the FIP Technology Advisory Group. And on a daily basis, I work as an executive advisor for Apoteket, a government-owned pharmacy chain in Sweden. Next slide, please. Today, we have a fantastic panel of experts with us. Dr. Dongbo from the World Health Organization, Dr. Tan-Ching Xiang from the School of Pharmacy in Malaysia at the KPJ Healthcare University College, Dr. Darush Attar-Sadeh from Northwest London Integrated Care Board, Right Brief, and our FIP Practice Development and Transformation Projects Manager, Ines Nunes da Cunha, and our lead for provision and partnerships, Dr. Dalia Valles. Next slide, please. Before we continue, I would like to highlight some housekeeping rules for today's event. This webinar is being recorded and live streamed via YouTube, and the recording will be available after the event at the events.fip.org. And we advise you to ask questions using the question box provided at the bottom of your screen. And of course, you're welcome to provide feedback to webinars@fip.org. because as such we can improve our digital events for the future, and which will actually benefit you as an attendee as well. And I also strongly advise you to become a member of FIP. This is probably the best investment you can make, as together we are stronger, transforming healthcare and pharmacy, and the world needs pharmacy and the pharmacist more than ever today. Next slide, please. Today is a very important day. It is the World No Tobacco Day, and this yearly celebration informs the public on dangers of using tobacco, the business practices of tobacco companies, what the WHO is doing to fight the tobacco epidemic, and what people around the world can do to claim their right to health and healthy living and to protect future generations. And FIP will launch the Tobacco Cessation Handbook for Pharmacists and the Knowledge and Skills Reference Guide for Professional Development, Tobacco Cessation, and other risk factors in NCDs. This is also an example, an excellent example of how FIP, in official relationships with the WHO since 1948, is aligning our goals with the goals of the World Health Organizations. If we look at the agenda for today, we can, if we can go back one slide, Gonzalo. Dr. Dongbo will talk about the WHO's recommendations, activities for promoting tobacco cessation. And Professor Tan-Ching Xiang will talk about enhancing tobacco cessation services and improving public health. And Dr. Darush Attar-Sadeh will show examples of pharmacists' brief advice interventions on tobacco cessations. And Dr. Ines Nunes da Cunha will launch the Tobacco Cessation Handbook for Pharmacists, and Dr. Dalia Valles will launch the FIP Knowledge and Skills Reference Guide for Professional Development in Tobacco Cessations and Risk Factors in NCDs. I would like to express a sincere welcome to all our experts at today's event. The objectives of today's event is that the attendees will learn about the global burden of tobacco dependence, how to raise people's awareness about tobacco cessation, the role of pharmacists in tobacco cessation, and the knowledge and skills pharmacists need for the delivery of tobacco cessation services. And furthermore, of course, we want to highlight the World No Tobacco Day and the launch of the new resources from FIP. I would like to start by focusing on the FIP development goals linked to today's event, and especially to the launch of the new handbook and the other resources. And they are mainly three. Goal number 9 is about continuing professional development. All professional development activities should be clearly linked with needs-based health policy initiatives and pharmaceutical career development pathways. And in practice and needs-based continuing professional development and continuing education should also be linked to career development pathways and practice frameworks. Goal number 5 is about competency development. There should be clear and accessible developmental frameworks describing competencies and scope of practice for all stages of professional careers. And these include also leadership development frameworks for the pharmaceutical workforce, as well as clearly defined developmental frameworks for practitioners. And goal number 15 is about people-centered care. There should be strategies in place to develop pharmaceutical education and the workforce to support the delivery of people-centered care in practice. And this includes collaborative, interprofessional strategies and people-centered professional services to support prevention, screening, clinical management, and therapeutic optimization on non-communicable diseases and long-term conditions. Next slide, please. FRP has a long history in working with smoking cessation. Already in 2003, we developed a statement regarding pharmacists' role in smoking cessation. Pharmacists, in common with all other health professionals, have a responsibility to help people who wish to do so, to give up smoking or other uses of tobacco, and to encourage others to do so. To this end, FRP fully supported the tobacco-free initiative of the World Health Organization. The briefing document establishing tobacco-free communities, a practical guide for pharmacists, developed 2015, gives a number of examples from around the world showcasing pharmacists' value in performing health promotion, triage, and referral, as well as other interventions. Next slide, please. Did you know that the tobacco epidemic is one of the biggest public health threats the world has ever faced, killing more than 8 million people every year? And more than 7 million of those deaths are the result of direct tobacco use, while around 1.2 million are the result of non-smokers being exposed to secondhand smoke. All forms of tobacco are harmful, and there is no safe level of exposure to tobacco. Cigarette smoking is the most common form of tobacco use worldwide, and it can be found in tobacco products and also like water pipe tobacco, various smokeless tobacco products, cigars, cigarillos, or roll your own tobacco, pipe tobacco, as well as in electronic cigarettes. Over 80% of the 1.3 billion tobacco users worldwide live in low and middle income countries, where the burden of tobacco-related illness and death is heaviest. Tobacco use contributes to the poverty by diverting household spending from basic needs such as food and shelter to tobacco. And of course, the economic costs of tobacco are substantial and include significant healthcare costs for treating the diseases caused by tobacco use, as well as the lost human capital that results from tobacco attributable morbidity and mortality. So tobacco is one of the world's leading preventable causes of death and is a major preventable risk factor for non-communicable diseases like cancer, lung, and heart diseases. The WHO Empower approach measures are in line with the WHO Framework Convention on Tobacco Control, the FCTC, developed in 2003. In currently 182 countries have ratified this treaty. Next slide, please. So in line with the WHO Framework Convention on Tobacco Control, the WHO introduced the Empower measures in 2008. And they are a set of 6, you can say, cost-effective and high-impact measures that help countries reduce demand for tobacco. And these measures include monitoring tobacco use and prevention policies, protecting people from tobacco smoke, offering help to quit tobacco use, warning about the dangers of tobacco, enforcing bans on tobacco advertising, promotion, and sponsorships, and raising taxes on tobacco. Next slide, please. As we all know, nicotine contained in tobacco is highly addictive, and tobacco use is a major risk for cardiovascular and respiratory diseases, over 20 different types of subtypes of cancer, and many other debilitating health conditions. Nearly half of all children breathe air polluted by tobacco smoke, and 65,000 children die each year due to illnesses related to secondhand smoke. So reflect upon this. Tobacco is the only legal consumer product that kills up to half of those who use it as intended by the manufacturer. Worldwide, it kills one person every 6 seconds. Next slide, please. FIP is currently working on a statement intended to inform governments and policymakers, FIP member organizations, pharmacy academic institutions, and individual pharmacy professionals of the position of FIP on the use of electronic cigarettes. It will be launched in the coming days, so please stay tuned to our website for updates regarding this new statement. Let us now jump into today's agenda, and it is my great pleasure and honor to introduce the first speaker, Dr. Dongbo Fu, Medical Officer for Tobacco Cessation at the World Health Organization in Switzerland. Welcome, Dr. Fu, to give us your presentation on WHO recommendations and activities for promoting tobacco cessation.
Okay, thank you, Lars. Good afternoon, good morning, good evening to everyone. I appreciate this opportunity to join today's event to celebrate 2023 World No Tobacco Day. The theme of this year's World No Tobacco Day is Growing Food, Not Tobacco, aiming to emphasize growing tobacco is actually a threat to global food security and nutrition, emphasize the economic and the environmental impact of tobacco. So whenever we talk about any dangers of tobacco, it's a reminder to all of us, it's very important to help current tobacco users to quit. So today's event emphasizing tobacco cessation is absolutely necessary. So I will take this opportunity to share with you what are WHO recommendations and activities for promoting tobacco cessation. So first, let's look at the fact which I think you just heard from Lars. Worldwide, we have about 1.3 billion tobacco users. On average, 60% of them are willing to quit. However, only 30% of them have access to comprehensive tobacco cessation services. In other words, 70% of them have no access to appropriate tobacco cessation services. This clearly shows the priority of our tobacco cessation work is to improve access to proven tobacco cessation interventions. So based on this understanding, WHO's first recommendation on tobacco cessation is for the country to prioritize population-based tobacco cessation approaches, which are the approaches that can help reach large number of tobacco users and also at a very low cost. In the newly updated Appendix 3 of the WHO Global NCD Action Plan 2013 to 2030, classified 3 population-based tobacco cessation interventions are the best buy interventions for prevention and management of NCDs. These 3 population-based interventions are briefly integrated into all healthcare systems, national toll-free quit lines, and Cessation. Here, I would like to just highlight the first approach, the briefly integrated into all healthcare systems. This is very much relevant to pharmacists because this approach actually emphasizes supporting tobacco users quit is everybody's business, every healthcare professionals, including pharmacists. Because if every health professional does it routinely, collectively, we could reach about 80% of all tobacco users per year in a country. So this is actually very, very simple, but a very feasible approach, able to help us reach a large number of tobacco users if we do it collectively. And then I'm sure we will recommend government to consider implementing all these three population-wide approach is another reason. It is a very good investment. In 2021, WHO developed the global investment case to help explain why countries should invest in tobacco cessation from health and also economic perspectives. A return on investment analysis of 124 countries shows these three population-based interventions cost only about $21 per person per year. If we spent this amount of money for about 10 years, by 2030, we could have 88 million quitters and could save 1.4 million people's life. So clearly, these three population-based interventions are very cost-effective. The second WHO's recommendation for promoting tobacco cessation is for the country to embrace innovative approach to scale up tobacco cessation interventions. We know what interventions work, as we just mentioned, but they are not yet reach a sufficient number of tobacco users. So the innovative approach, such as digital technologies or artificial intelligence, can help increase the reach of the proven tobacco cessation interventions, which will include both improving the supply and the demand for tobacco cessation tools. Now I'm going to share with you what WHO has been doing to promote tobacco cessation in the last 15 years. The first activity is to setting norms and standards to guide the countries on tobacco cessation practice and also help standardize tobacco-dependent treatment at country level. For example, WHO has developed a recommendation for TB and tobacco control integration, tobacco cessation and oral health integration. We also have recommendation on prevention and management of tobacco use and secondhand exposure in pregnancy. We also developed technical guidance on how to develop and improve national toll-free quit lines. WHO is currently in the process of developing a clinical treatment guideline for tobacco cessation in adults, which is expected to be published by the end of this year. In terms of pharmacotherapy, WHO had 2 successful applications for adding NRT and bupropion on WHO model list of essential medicines. WHO also supported a varenicline application. We now have 3 tobacco cessation essential medicines on WHO model list of essential medicine. We hope national government will do the same, adding these 3 essential medicines on their national essential medicine list. The second activity for promoting tobacco cessation, which WHO has been using, is to develop technical resources and tools. We have developed a series of training packages and training courses to promote tobacco cessation. So you can find some actually is focusing on promoting integration of brief devices into primary care. Some is focusing on how to help country develop and improve their national toll-free quit line. Some is helping country to set up tobacco cessation projects. With these tools available, in the last 12 years, we have been providing technical support to more than 80 countries to strengthen their 3 population-level tobacco cessation interventions, which we just discussed before. The capacity building support actually supported the country across all 6 WHO regions. The last activity WHO is using to promote tobacco cessation is to develop digital tobacco cessation tools. During the COVID-19 pandemic, Together with partners, WHO has developed a digital health worker called Florence. I'm sure you're all familiar with her. Florence actually is an AI-based online conversational program which can provide a brief advice for tobacco users to quit. During the pandemic, WHO has also added a 6-month text messaging program onto the major social media platforms, such as WhatsApp, Facebook Messenger, and Viber. These tools were able to reach 500,000 of people within a few months after launching the tools. So please feel free to share the link I shared with you so we can get more people to use these very useful tobacco cessation tools. So in summary, in the last 15 years, what WHO has been doing is to support countries to develop and strengthen their national tobacco cessation and treatment system with the focus on 3 population-level tobacco cessation approaches. So that's all I'd like to share with you today. Thank you very much.
Thank you so very much, Dr. Dongbo Fu, for this interesting presentation. A lot can really be done and has been done in promoting tobacco cessation, and also, as you say, with limited resources, but they are still very cost effective and saving many lives, and of course, increasing quality of life. And also, we are now able to reach out to many more by using technology and artificial intelligence, for example. Let us now continue to our second speaker, Professor Tan Xing Xiang, Dean of the School of Pharmacy, KPJ Healthcare University College in Malaysia. Welcome, Dr. Xiang, to give us your presentation on enhancing tobacco cessation services and improving public health.
Thank you, Lars, and thank you, FIP, for having me today. Okay, good day to all the audience. Okay. Okay, Lars, I am unable to control the slide. Okay, yeah. Okay, sorry for some technical error. Yeah. Okay, for my today's sharing, this is the outline that I will share. Okay, so first of all, I will give some overview of the tobacco epidemic, then followed by the critical roles of the pharmacists in tobacco cessations, followed by key responsibility of the pharmacist. That I will zoom into the pharmacological interventions and behavioral interventions, followed by challenges and opportunities. Then ultimately, we'll go for the take-home message. Okay. This is the overview of the tobacco epidemic that has been shared by the moderator in the earlier slide. In 2020, 22.3% of the global population used tobacco, and out of that, 36.7% of all men, that is more than 1/4, and 7.8% of the world's women. Okay. I will share you some local prevalence. That is a statistic from Malaysia. Okay. So we can see that this is based on the data, the national health data from Malaysia. So in 2019, there is a total of the 21.3% of these smokers in Malaysia. So from here, I can verify that the WHO data is accurate. It's almost similar with Malaysia as well. So same as well as Malaysia. Yeah, and there is actually some slightly reductions of the prevalence of smoker in Malaysia from 22.8% to 21.3% in 2019. And it is estimated that more than 27,000 of Malaysian deaths annually are related to the smoking. It can be due to the lung cancer, pneumonia, cardiovascular disease, and etc. Okay. And out of that, it was estimated that 4.8 million Malaysians aged 15 years and above currently smoke. So we can see that the smokers, the age is become younger and younger. Okay, and for the topic of the e-cigarette and vape use, in Malaysia, the prevalence of e-cigarette or vape use was highest among those in the 20 to 24 years old age, and perhaps they will use it as a leisure or grammar purposes. Okay, and next, about quick attempt. In Malaysia, less than half of the color smokers make an attempt to quit smoking in the past 12 months. So sadly, we can see that more than half, they are still enjoying their tobacco. And less than 10% of the color smokers visited a healthcare providers in the past 12 months. And more than 3/4 of the color smokers who visited the healthcare services, like for example, in hospital, in the community pharmacies, in the past 12 months have been advised to quit smoking by the healthcare providers. So during their receiving the medication or refilling their medication, the healthcare professionals, for example, pharmacists, they have given the sufficient counseling to quit for smoking. And here we come to today's focus, the critical role of the pharmacist in tobacco cessations. And there is a very fantastic research study from this Australian. 102 smokers were enrolled in an Australian trial of a pharmacist-led smoking cessation in a hospital setting. And they were randomly assigned to 3 groups. The first group is community pharmacist based, the second is hospital based, and the third is the control group, that is a minimum intervention, no nicotine replacement therapy. After 6 months, the abstinence rate were higher in community pharmacy based with 38% versus community pharmacy based 24% versus the last one, minimum intervention, only 4.6%. So for the audience, the abstinence rate here refer to the smokers. Once they decided to quit smoking, they will not come back to the smoking again. So we can see that the highest rate will be the community pharmacy based. Okay. And here I would like to mention that the MQuick is another one of the successful program that has been implemented in Malaysia. That this is actually a one hybrid public funded clinic and community pharmacy website, which was introduced in 2016 in Malaysia and offer a variety of the venues for the smoking cessation services to the smokers. So I mean the smokers, they can register themselves in the website and then choose any preference of venues they want to quit for smoking. Yeah, and currently, the government of Malaysia also leveraged the My Sejahtera apps that we used it during the COVID pandemic time, and then spread to the public, and the public can use this widely operate apps to register for the quit smoking. Okay, here I would like to share some successful pharmacist-led tobacco cessation program from different countries. So we can see that from this multiple research study, I can say that the minimum successful rate will be the 10% minimally, and the highest will be the 55%. There is a congratulation to this Augustine and Taylor and the team for this research study for the pharmacist provided telephone-based quick counseling services. Okay, so other than that, we can see that nowadays the pharmacists need to be smart and leverage any of the electronic together with this evolving era, so we can get some attention from the smokers and then attract them to join this tobacco cessation program. Okay, why pharmacist matters? It is because pharmacists provided excellent location in which to provide the smoking cessation services. I believe that most of the country nowadays, the community pharmacies is scattered around in the nation. Okay, so not only the community pharmacy, in hospital, even the pharmacy station in the primary health clinic. So we all can interact with the general public, patients, family members, and carers who potentially encourage the potential smokers to quit. Similarly, those patients with the cardiovascular disease or any non-communicable disease approach to your pharmacist. So we can just ask them that, are you interested to quit if let's say they are the smokers? So here we can see that there are plenty of the important role that can be played by the pharmacist. Okay. The key responsibility of the pharmacist, there are two important roles. The first will be the pharmacological interventions. The second will be behavioral interventions. Okay. And I would like to share some evidence for you. In terms of the pharmacological interventions, recent systematic reviews show that while nicotine replacement therapy increased the likelihood of success by 50 to 70%. This is a very promising data. Well, compared to the baseline, individual willpower alone only produced as low as 3 to 8% of abstinence. Okay, so we can see that there is a huge successful rate if let's say we can supplement with this nicotine replacement therapy. Unless it is contraindicated, pharmacotherapy should be made available to all smokers who are trying to quit. For example, the nicotine replacement therapy, we have a variety of the pharmaceutical format or the forms, like for example, gums, patch, okay, and then the non-nicotine based, like for example, valine cream, and sustained release, for example, bupropion. Later, other panels, they will elaborate more about the pharmacological actions. Okay, valine cream was about 50% more effective than any nicotine replacement therapy, monotherapy. Okay, but similar in efficacy to combining two types of the nicotine replacement therapy. For example, some smokers, they are using the gums as well as the patch during the nighttime. Yeah. Okay, this is the interesting pharmacokinetic analysis. Okay, so we can see that the cigarette. Okay, actually the cigarette, right? The nicotine will go directly to the arterial blood circulation in the system. That's why the smokers can get this rapid euphoria effect compared to the nicotine replacement therapy, which will be absorbed through the venous circulations. And it will be more than a minute, or maybe more than I think it's take a few minutes compared to the cigarette that have this rapid absorptions. Okay, and then the longest absorptions will be the transdermal patch. Okay, this is part of the reason that the smokers couldn't feel this sufficient, especially the euphoria effect caused by this dopamine release. And so similarly, cigarette, I mean the nicotine replacement therapy, it will take some time. It will take some time, several minutes to achieve for this stable level. Okay, and there are several of the formulations from this nicotine replacement therapy. So we can have this patch that is available in the several dosing, gums, inhalator, sublingual tablet, lozenges, nasal spray. Okay, so here all the national pharmacy society and also the government sector play an important role that to give the sufficient training to the healthcare provider, especially to the pharmacists, that the proper and accurate instruction of use must deliver to the smokers, to the tobacco user. So including that all the detail like chew the gum until the taste is strong, otherwise just rest the gum between the gum and the cheek and chew again when the taste has faded. So all this is important, the detail, the tiny detail instruction of use need to be delivered to the tobacco user. Okay. So and then I follow by this another important element that is a behavioral intervention. So there's evidence that increasing the amount of the behavioral support for individuals using a smoking cessation agent increase their long-term chance of quitting smoking by 10 to 25%. Okay. Motivation to ease smoking. Smokers should be asked if they wish to quit. Pharmacists need to play as a coach and then we need to coach and facilitate the smokers, and both parties we set a one date that, okay, perhaps in the next 30 days you need to reduce your tobacco, or you need to set a quit date, okay, so that we can set a one similar goals with the smokers. Okay, the challenges and the opportunity. Okay, so nowadays we can see that the smokers, they are changed from the traditional cigarette to the e-cigarettes, are being misused. They are used these cigarettes or vaping for the recreation purpose rather than as an aid to stop smoking. Some of the youngsters therefore use the e-cigarette for glamour purpose, while conventional smokers are becoming dual smokers. So this is one of the challenges for the as a pharmacist. So for this smoking cessation services, we need to tackle for these dual smokers as well. To make this smoking cessation services program more attractive, so that it can be accepted by the public, and as well as therapeutic important in preventing the non-communicable disease such as the cardiovascular disease and the cancer. Next, we need to have a sufficient training, especially to certify the pharmacists or any healthcare providers to give these smoking cessation services. Okay, and about certain country, we have some limited reimbursement from the government. Okay, and we also need to integrate in the healthcare service, healthcare system, to collaborate with the other healthcare providers such as the physicians and also the nurses. Okay, so the next, what the pharmacists with this pharmacological knowledge. So based on this pharmacological theory, that we can actually innovate and also create new medications. Like for example, we understand that this nicotine, eventually it will go to this VTA in the brain area and to stimulate the dopamine. So we can put a more R&D and to design a new drug in the future. Okay, take home message. Eradication of the tobacco use and nicotine addictions has an important pharmacy services. And then the success of the pharmacist-led smoking cessation services is own determination plus pharmacotherapy and intervention behavior. So training, education, certification are needed. And also the cost is of the accessibility and availability of the medication. Just share with you one example. Like for example, one of the nicotine 4 mg gums with about 105 pieces in Malaysia, it costs about 22 USD. Okay, and one tobacco with 20 stick of the tobacco, it costs about 2 ringgit and 60 cents. Okay, so eventually, based on my previous experience as a community pharmacist, right? Sometimes the smokers, they will complain that they are too expensive for this nicotine replacement therapy. However, they are rather to spend this money in the tobacco. So we need to explain to them sufficiently that in the long term, this nicotine replacement therapy actually can save for their money and also good for their health. Yeah. Okay. So lastly, I would like to emphasize that pharmacist-led smoking cessation services are up to 50% successful rate. Okay. Thank you for your hearing. That's all for my presentation. Thank you.
Thank you so very much, Dr. Tan Ching Siang, for your presentation. It's indeed clear that pharmacists contribute a lot to smoking cessation. And it's also interesting to see how outcomes are becoming better by using behavioral sciences and motivational techniques. However, I find it alarming that many young people start to smoke, and it's also very interesting and important to address that electronic cigarettes are actually used, as you say, for recreational purposes rather than as an aid to stop smoking, and also while conventional smokers are becoming dual smokers. So this is something we might need to address in the future as well. Let's now move on to our third speaker, Dr. Darush Attarzadeh, Clinical Fellow, Respiratory Pharmacist at Northwest London Integrated Care Board, Right Brief. Welcome, Dr. Sadeh, to present on examples of a pharmacist brief advice intervention on tobacco cessation.
Thank you very much, Lars, and thank you, FIP, for this very kind invitation. So I'm a pharmacist based over in UK, in England, but basically in London. And this is one of the community pharmacies I was working in, which was around northwest London. So this was a health promotion zone in our pharmacy to promote, and what we could do in this zone was promote brief intervention, which can start as little as 30 seconds, we say, to save a life almost. So very little time. And in England, we say you're never more than 20 minutes away from a community pharmacy, very easily accessible. And it's something I've been passionate about with regards to smoking cessation or treating tobacco dependence for the last 25 years. So I'll just give you a bit of a snapshot of what can be done as a couple of examples. We call, one of the examples is called the 3 A's, or Ask, Advise and Act approach, which I'm going to talk about shortly. And also there's also the 5 A's approach. But the health promotion zone will help engage interest amongst your patients walking into the pharmacy. And this is one of the examples of a zone. I'm part of the Treating Tobacco Dependency group as part of the International Primary Care Respiratory group. And I'm also fortunate to be part of the Asthma Right Care and COPD Right Care team as well, working amongst a real multidisciplinary team just to really upskill clinicians and patients, of course. But one of the things that alerts me, because I'm a prescribing pharmacist as well over in England, and I prescribe inhaled treatments. And one of the things that gets to me is how tobacco is, anything else I do, like inhaler technique or anything you guys do in the pharmacies with treating respiratory conditions, treating tobacco dependency trumps pretty much every other intervention we can make. And of course, it starts from, we say, maternal smoking. So it's really important that we're proactive and get involved in prevention. And when we think of inhaled treatments, we know how they work on the smaller airways in our lungs. But of course, inhaling pollution or inhaling tobacco as well, of course, will harm the precious lungs. So as an example of a brief intervention in pharmacy, in community pharmacy, there's lots of advantages. So part of the work I've been doing over the years is to motivate colleagues internationally, of course, as well, just to highlight what a valuable role pharmacy plays. And as I said, for 30 seconds, as little as 30 seconds to really make an intervention. In England, we normally, from studies as well, we've seen for every 2 people we help stop smoking, 1 life is saved. No other intervention can be like that. It's just an amazing achievement. But of course, it has not only benefits to the patient, but of course benefits to the community pharmacy as well with regards to lots of things around. You can see customer loyalty, and you get thank yous from patients saying, without your support, I don't think I would have been able to do this. Because we say stopping smoking is one of the hardest things a person can do. It's obviously an addiction, and we describe it as a chronic, relapsing, long-term condition that generally starts in childhood, because most people start before the age of 18. So it's important we can offer that support. And this is where I think, again, these healthy living pharmacies across England are really intervening with window displays and using badges and doing things for World Tobacco Day or National No Smoking Day, etc. As part of my health promotion zone that I use, and as well as a lot of colleagues, we like to use tar jars. This is just an example of the one I'm holding there, a year's worth of tar in a 20-a-day smoker. So anything organic that you burn generates tar and carbon monoxide. And carbon monoxide is what starves your lungs, your heart of oxygen. So it's a really great motivational tool that we can use to support people to go smoke-free. When smokers see their readings as a smoker and they get alarmed by those high readings, what ends up happening is people sometimes actually want to stop because of that reading. As mentioned earlier, 60% of smokers do want to stop, and that very brief intervention or brief advice can make a real difference. So what was great to see is the World Health Organization Guide to Brief Intervention was released, and gives examples of it gives examples of the ask, advise and act approach that I'm going to share with you in a moment as an example in England. But also we talk about the 5 A's approach, which takes a little bit longer than the short brief advice I was talking about earlier, 30 seconds. These ones can take 3 to 5 minutes, or sometimes even a bit longer. So I'll talk through a couple of examples. One of the resources I think you will find very helpful is the very brief advice desktop helper, which was released in 2019 from the International Primary Care Respiratory Group. Just to give you a top line, the ask, advise and act approach, what you might normally do is ask a person if they smoke. You advise the person that the best way to stop smoking is with a combination of support and treatment. And in England, we have the National Health Service, which is available on the NHS or the National Health Service. The act part is acting on the person's response. So if a person is interested in stopping, that's great. We then signpost them to the support that's available, and it could be telephone support, it could be face-to-face support. In some instances, we can even do group consultations, or you could use artificial intelligence, of course, to support. If a person's not interested, then of course our door is always open to support that patient. So as an example, in a UK pharmacy, on the left side, as an example, if somebody was buying over-the-counter medication like cough syrups or sore throat remedies, I might follow this ask, advise and act on selected patients. Or if somebody's bringing in prescription medications for anticoagulation or for respiratory prescriptions or anything along those lines, or if a person is coming in for a vaccination in the community pharmacy, there's so many good opportunities to intervene there. And that's where I would give examples of where I might intervene. For example, if I'm offering a flu vaccination, I might say to the person, did you know, if I find out they're a smoker, did you know that you're 5 times less likely to develop flu, for example, if you're a non-smoker? So talking about the advantages of the things you can do. Or pneumonia, for example, you're twice less likely to develop pneumonia. There's lots of data we can do to support that, but it's just strap lines about how you can start that sometimes awkward conversation with a smoker, but knowing that 60% do want to stop and it's niggling at them. So what I put together as well is the importance of secondhand smoke exposure. So I might ask a person, do you by any chance live with a smoker or do you smoke yourself? Might be my ask in this instance. If somebody's buying some stop smoking medications, you can ask further questions. There's something that an acronym we use in the UK called WHAM, which normally stands for something else when you're asking if a person's buying a medicine over the counter. But you can ask a person, who's the stop smoking aid for? Why do you want to stop smoking? How many cigarettes do you smoke a day? And how soon after waking up do you have your first cigarette? This is if I had a little bit more time than 30 seconds. The actions might be along the lines of, have you tried stopping smoking previously? And are you on any other medications? So there's lots of places where we can actually target and support patients, and not to forget that motivational carbon monoxide machine to help people go smoke-free. So the 5 A's approach is, if you got longer than the 30 seconds, is where you can explore and delve into a person's motivations, for example. So the ask is the first bit. Do you smoke? As before. You can advise the person that if they're an asthma patient, for example, you may say to the person that continuing to smoke may make your asthma worse and quitting may dramatically improve your health. You might ask questions like, what do you not like being about, what don't you like about being a smoker, or what do you like being about a smoker? So it's just the pros and cons of smoking. You could get into that for this, because a lot of patients are still ambivalent sometimes about whether they want to stop at that point. You can assess the readiness to stop, and sometimes using scaling questions like on a scale of 0 to 10, where 0 is low and 10 is high, how confident are you to stop smoking, or how motivated are you to stop smoking? So motivation and confidence or importance there is really important to explore, and you can use scaling questions to help you. The assist part is with a quit plan. Again, looking at, you don't have to cover all of this in great detail, but because you could maybe have a dedicated appointment with the person. But what I would do in the quit plan part is I find out when that person's thinking about stopping altogether. So when would you like to stop smoking? And it's very much about them and about them being the active participant in their quit attempt. So you said that you're planning to stop in a week's time. That's fantastic. What sort of things do you think you can do to prepare yourself for your quit attempt? Do you think family and friends will be supportive? Have you tried stopping smoking previously, and how did you find that? Oh, you stopped for 2 days previously. That's fantastic. How did you manage to do that? Praise every single effort. But then, of course, you can arrange a follow-up with the patient if that's right for them, and also if you're the person who's able to deliver that and has had the training to deliver that too. So that's the 5 A's approach, and behavior change is so motivating to support a patient with a harmful behavior like this. And the hardest part of stopping smoking, we say, is the staying stopped. So part of this IPCRG desktop helper talks about some of those great benefits after you stop smoking in the long term. So there's some data to support that and references. So I always like to say that when a person stops smoking, it only takes 8 hours for the carbon monoxide to halve, or 24 hours for it to come out of your system, 2 to 12 weeks before circulation starts improving, where you start noticing those benefits. And it's great when you're hearing that back from the patients, because they do get immediate benefits. But as I say, the hardest part of stopping smoking is the staying stopped. So it's normal for people to go back to smoking. But the good thing is they will learn and become wiser with each quit attempt. And just finally, just reminding patients and yourselves that smoking shisha or water pipes or cigarettes or roll-ups, whatever you smoke, the tobacco companies have manipulated their products so it works quickly, works very fast. Within 7 seconds, you get that rapid absorption. So we need to manage patients' expectations with the nicotine replacement treatments, that they don't work as quickly as the cigarette, but they're there to help take the edge off those cravings and manage those cravings. And with the support and treatment, they're many times more likely to stop. And great to see that the essential medicines list has been expanded to include varenicline, bupropion, as well as nicotine replacement therapies. So that's my talk. Thank you very much for your attention.
Thank you so very much for this excellent presentation with the great examples from pharmacy, what has been done and what can be done. And I think that the 5 A's, ask, advise, assess, assist, and arrange, summarize many of the activities that the primary care provider, as the local pharmacist, can do to help a tobacco user within 3 to 5 minutes in a primary care setting. And this model can also guide us through the right process to talk with patients who are ready to quit about tobacco use and also deliver advice. And also, I think that your slide about the benefits of quitting smoking should be convincing to everyone who is a smoker today. So thank you so very much. The time has now come to introduce the launch of the Tobacco Cessation, a handbook for pharmacists. And it is a great honor to introduce Dr. Ines Dacuna, FIP Practice Development and Transformation Projects Manager at FIP. Welcome, Ines. The stage is yours.
Thank you very much, Lars, and hello, everyone. And I also to thank you very much to our first three panelists for their amazing presentations and for their contribution as a reviewers of the supporting tobacco cessation and the treatment of tobacco dependence and for pharmacists. I start to say that it is a huge pleasure to be here today presenting this important publication that you can find in the link you can see in the next slide. Yes, this slide. Or also you can find this publication at the FIP microsite on NCDs. The publication I am presenting today was a joint effort involving several authors and reviewed by a group of experts in the field of tobacco cessation from around the world. As said before by my colleagues, the negative effects of tobacco use on health are well documented. However, giving up tobacco and quitting can be a challenging process, but the journey towards a tobacco-free life can be made easier with the right support. And pharmacists have an important role to play in helping tobacco users quit and remain abstinent. Pharmacists' expertise and accessibility ensure they are ideal providers of evidence-based advice, medication and support to those who want to break their addiction to and dependence on tobacco. Next slide, please. This handbook has been developed as a comprehensive and practical resource for pharmacists to support individuals in their efforts to quit tobacco, emphasizing the critical role of the pharmacists in providing comprehensive and coordinated care to patients seeking to quit. It covered the latest evidence-based practice, techniques, and strategies to help our patients quit and not start again. By using the information and strategies outlined in this handbook, pharmacists can contribute to improving public health and reducing the burden of tobacco use on healthcare systems. Next slide, please. In the context of our work at FIP on NCDs, and particularly as part of the FIP Practice Transformation Program on NCDs, it is proposed that this program helps patients avoid the risk factors for NCDs, such as the tobacco use. And tobacco use cessation is one of the most important interventions to reduce the prevalence of non-communicable diseases, like said before. And pharmacists can contribute to support tobacco cessation through different interventions, like my colleagues already mentioned, but as you can see in the slide, by health promotion and education, inquiring about tobacco use, behavioral change support, pharmacological interventions, and much more. And to give you an overview of the handbook on the next slide, you can see that this handbook is organized into 6 chapters and covers various aspects of tobacco cessation, including the burden of tobacco use on public health, the role of pharmacists in tobacco cessation and the treatment of tobacco dependence, and strategies for providing effective care to patients. It also provides practical guidance on how to conduct patient assessments, design treatment plans, and select appropriate medicines to manage withdrawal symptoms. The handbook also covers strategies for providing patient education and support, monitoring and adjusting treatment plans, and referring patients to other healthcare professionals if necessary. To give you a little more information, on the next slide, you can see that the first chapter provides an introduction to the topic, like I said before, the burden of tobacco use around the world, the benefits of quitting, for example. The second chapter, you can find that in the second chapter, looks at the impact of tobacco use on patients with underlying diseases, such as NCDs like cancer, cardiovascular diseases, diabetes, chronic respiratory diseases, and also mental illness. And also talks about the impact of tobacco use on specific populations, such as young people and pregnant women. Chapter 3, on the next slide, you can see that looked at different pharmacy-led tobacco cessation interventions. Some of these have already been mentioned in the previous presentations. And chapter 4 provides some additional resources and tools to supporting quitting, like telephone support, digital apps, tools for tobacco dependence assessment, and much more. In chapter 5, you will find some examples of tobacco cessation campaigns that you can see on the next slide. And also chapter 5 is all about programs from around the world. And finally, chapter 6 highlights the importance of interprofessional collaboration to support tobacco cessation. In conclusion, you can see on the next slide that this handbook presents successful examples of evidence-based tobacco cessation interventions by pharmacists from around the world that have led to improved health outcomes and economic benefits. We trust that these examples will inspire and provide valuable guidance to pharmacists who are committed to supporting individuals in their efforts to quit tobacco use. FRP is committed to working with its member organization and individual pharmacists worldwide to enhance and expand the role of pharmacists in tobacco cessation and treatment of tobacco dependence, thus making a meaningful contribution to public health. FRP encourages you to take the time to read throughout this handbook and familiarize yourself with the resources and strategy it provides. Together, pharmacists can help their patients achieve a tobacco-free life, reduce the risk of developing NCDs, and improve their overall health and well-being. And before ending my presentation, I want to express my sincere gratitude to all the authors who collaborate in the drafting process of this handbook, whose names are listed on the slide. Thank you very much for your expertise and collaboration. And I would also like to thank all the members of the advisory group, whose names are listed on this slide, for their valuable comments and suggestions during the revision of this handbook. And FIP also are grateful to the World Health Organization for its expert contribution to this publication. Thank you very much. I hope you enjoyed this publication.
Thank you so very much, Ines. I totally agree with you. Pharmacy can help patients achieve a tobacco life, reduce their risk of developing NCDs, and improve their overall health and well-being. And the resources now developed will be a super excellent tool for us promoting tobacco cessation and helping people to get a healthier life. It is now time to approach our last speaker for today, Dr. Dalia Bayes, FIP lead for provision and partnerships at FIP. Welcome, Dalia, to launch the FIP Knowledge and Skills Reference Guide for Professional Development in Tobacco Cessation and Risk Factors in NCDs.
Thank you so much, Lars, for your kind introduction and fantastic moderation. And special thank you to all of the previous speakers for really providing us with a comprehensive yet really insightful overview on the importance of promoting smoking cessation, tobacco cessation in our public. And I'm delighted to join my colleague Ines today to launch in tandem with the handbook, the Knowledge and Skills Reference Guide for Professional Development in Tobacco Cessation, but also touching on other risk factors in the areas of non-communicable diseases. Next slide, thank you. I'd like to first pay tribute to the two co-authors of the publication, my colleagues, Dr. Genuine Disera from Kenya, and also Mrs. Alison Yutakaban, who is the FIP Educational Partnerships and Projects Manager with us here in the team. Thanks a million for both of your efforts and support in developing this publication. So to provide you with some background, as our speakers already provided background to the topic and the context to all of this work, FIP is delighted to be able to provide our profession, the wider audience with us today and those listening afterwards, our practitioners, but also our educators, pharmacy students, another useful resource that outlines the knowledge and the skills that one in this profession, in pharmacy, requires to attain to be able to provide and support with the services that some of our colleagues have already mentioned. Our first speaker, Dr. Fu, said that tobacco cessation is every healthcare professional's business, and pharmacists are also have business in tobacco cessation, and definitely an area that due to their accessibility and skill set and medicine expertise can provide and support our patients and individuals with. So I'm delighted to be able to share with you that this knowledge and skills reference guide can support our professionals, our practitioners, our educators in upskilling themselves and others in the area of tobacco cessation and also in other risk factors in NCDs. It's a companion publication to the handbook. So my colleague Enes already outlined some of the components of the handbook. And so you'll find, once I'll provide you with the QR code in a moment, that, you know, a lot of the knowledge and the skills that have been outlined in this reference guide align very well with the interventions and the information that has been provided in the handbook. So you'll find that they actually work in tandem, so that it makes a lot of sense to have them both at your fingertips. This guide is not only for our own professional development, but it can also serve as a useful resource for CPD providers, educators who educate others as well. It provides a good reference point for those that already have existing programs in this area or are intending on developing new programs. So I invite a whole array of audience members to explore the reference guide. Thank you, Gonzo. And as our colleague Lars right at the beginning mentioned, this is not a new topic at FIP to be explored. This is a global health threat, and FIP has been an advocate to promote tobacco cessation from a while back, and we have built the knowledge and the skills guide utilizing references already provided by FIP, as well as global international resources to support developing a comprehensive KNS for your professional development. As I already mentioned, our resource with the handbook worked in tandem, so a lot of the ideas that came from the handbook are embedded in the knowledge and the skills guide so that they can work together. We identified the pharmacist roles, the services, the interventions that someone can embark upon in this area. We supported it by further literature consultation, but we also had an advisory group that we were able to consult, a few of which are actually part of the speakers today, who we are very grateful for their contribution to develop, to review the document. And therefore, this is our process for developing the reference guide in a nutshell. And I'll provide you with more information about how it looks like on the next slide, or how it was developed further. I would like to bring to your attention that at FIP, we also have the Global Competency Framework that outlines in 4 big clusters, 4 big areas, the areas that pharmacists should have competence in. These are pharmaceutical, public health, pharmaceutical care, organization and management, and professional and personal aspects as well. And so it's really important for us to link to the competency framework. Where do the knowledge and skills sit under different clusters? And so you will find in the handbook that we started out with the broad topic areas linked to the global competency framework, to those 4 areas of competencies. And we then developed core topics related to the pharmacist role in tobacco cessation. And we delve further to provide very specific or a granular level of topics on the knowledge and the skills that one is to acquire to serve our patients and our populations better. Thank you. On the next slide, I also share with you that the reference guide is organized by provides 2 main tables. The first table is the knowledge guide, which outlines the knowledge areas that one should demonstrate knowledge in, but also we've included an extra table with associated skills that one needs to acquire or obtain or demonstrate in practice when serving our patients and and communities in this area to support them with their endeavors in tobacco cessation. So you'll find that the knowledge guide and the associated skills guide overlap in certain aspects, but they're also complementary as well. You can use the guide as a self-learning tool for your professional development, as I already mentioned, but it can also serve as a supportive tool for the development of educational training, learning resources in the area of tobacco cessation. Providing you here with just a screenshot of how the information is organized. As I already mentioned to you, the broad categories in the dark blue, they relate to the competency clusters that we have in the global competency framework. Then we go into more broad topics such as public health strategies in this case, but we also provide more specifics topics such as advocacy and prevention, screening and referral that fit under the umbrella of public health strategies and advocacy. So it brings me now to a great pleasure to share with you for the first time the knowledge and the skills reference guide for professional development in tobacco cessation and other risk factors in NCDs. And you're very welcome to scan the QR code to access the resource. I'd like to mention at this point why it is that this reference guide also touches on other risk factors in NCDs. As already our speakers alluded to earlier, whilst tobacco cessation is a major health threat and also contributor to non-communicable diseases, we also know that it's not the only modifiable risk factor in the burden of non-communicable diseases. We also have lack of physical activity, misuse of alcohol, but also dietary aspects. So we wanted to touch on those in this KNS so that we can provide you with a comprehensive set of knowledge and skills, not only with the tobacco cessation, but also to support our patients tackle other modifiable risk factors to reduce the burden of NCDs in our communities. I would like to also send special thank yous to the 3 reviewers whose names are listed on your screen, who were kind enough to share their expertise and their knowledge to review the KNS, one of whom is Dr. Fu, who's with us today on the call. Thank you so much for all your support. We are delighted to have worked with you. Colleagues, I would like to take an extra minute of your time to talk to you about the Provision and Partnerships Program at FIP. I am the lead for this program, and I'd like to share with our audience who may not know that FIP is the global body representing pharmacy and pharmaceutical scientists and educators around the world. Our vision is for everyone to benefit from access to safe, effective, quality, and affordable medicines, health technologies, as well as from pharmaceutical care services provided by pharmacists, but in collaboration with other healthcare professionals. Our mission is to support global health by enabling the advancement of pharmaceutical practice sciences and education. FIP provides a global platform for partnerships to provide opportunities for our professionals, our practitioners, educators, and scientists to fill any professional development gaps for our member organizations, where they identify there are professional development needs in particular areas such as non-communicable diseases, tobacco cessation, FIP provides a platform for such collaborations and partnerships. And we do this via in a number of ways, but one of the ways we do this is by the FIP seal, which is a symbol of, or a visible symbol of quality, but also alignment of a particular program with our mission, our goals, our objectives to advance pharmacy worldwide in particular areas. And so on my next slide, whilst this was just a very, very brief introduction to the topic, I would welcome you if you are an educator on the call, or if you're a CPD provider or know about good quality training programs for pharmacists in the area of NCDs, tobacco cessation, or of relevance, I would invite you to learn more about the FIP SEAL program, by which FIP may collaborate and forge new partnerships to really upskill the global profession in areas where it is needed. You're very welcome to go on our website or scan the QR code on the screen. I will also add my email address in the chat if you wish to ask any further questions. I would like to thank the organizers, the facilitators for this webinar. Thank you so much, Lars, for your moderation. And thanks for the opportunity to be a part of this marvelous launch event of the handbook and the KNS guide in tobacco cessation. Thanks a million.
Thank you so very much, Dalia, for presenting the reference guide and how it can be used as a self-learning tool for professional development, but also as a supportive tool in the development of education and training courses in NCDs. And I think this is also a most valuable tool for our practice. And as you said, collaboration and partnerships are crucial for making the world a healthier place, as together we are stronger. I would now like to ask all the speakers to turn on their cameras, because we will have the Q&A session. And thank you all, firstly, for excellent presentations. We do have some questions. Let's see, turn on the video. Yes, we have some questions here. I would like to address the first question actually to Dr. Dongbo Fu. We have a question here from Abikadir Hassan Abdullahi. How using electronic cigarettes, can they help someone instead of complete cessation of smoking? What is your thought? What are your thoughts on these electronic cigarettes?
Thank you. I think the question around the e-cigarettes always coming up during any kind of events, I think. Thank you for the question. Yeah, the position on e-cigarettes or vaping products of WHO, you can find on our website. Actually, you can find them. In summary, WHO believes at this moment the potential role of ENDS products or e-cigarettes to play as a population level tobacco cessation intervention is unclear. The reason is the evidence on the use of ENDS products as a cessation aid is still inconclusive. So you can find many elements about it. For example, the diversity of these products. We don't know exactly sometimes what kinds of product they're talking about. And same you can find many studies actually have very low certainty. So of course, WHO also will update following any emerging evidence to see if any change can be made. But at this moment, just want to say that WHO believe is unclear about the role of ENDS as an effective cessation intervention.
Thank you. Thank you. Darush, you showed us very many practical examples from pharmacy in UK that has been done and that can be done. Do you have also some kind of strong collaboration within primary healthcare, so they actually refer patients from primary healthcare to the pharmacy for support and guidance?
Yeah, absolutely. I think in England and also in other nations across the United Kingdom, there are some very strong stop smoking services. And what tends to happen is GP practices may have their own trained advisors, but if they don't, a lot of the time they will refer onto the local community pharmacies for that support. In fact, we're in a situation where we have a National Health Service where medications like patches and gums and various other things can be prescribed, but the clinicians generally wouldn't prescribe those unless the patient is getting behavioral support with it, because we know that support and treatment together, you're many times more likely to stop. So that combination is really essential, rather than just selling the medicine over the counter in a pharmacy or prescribing it in primary care. It's referring on to get that additional support and finding the right support that's right for that patient and tailoring it to them.
Okay, so how is that used, for example, if a patient is staying at the hospital? Are there some kind of activities to promote smoking cessation for these patients, for example?
Yeah, absolutely. So there's the National Centre for Smoking Cessation and Training. We've developed some training package for the community pharmacists to get involved with supporting patients that once they're in hospital getting support, which follows this very good Ottawa model where the patients are, the hospitals are smoke-free, so they're giving support to stop whilst they're in hospital and treatment. But as mentioned earlier in my talk, the hardest part of stopping smoking is staying stopped. So what we don't want is for patients to be discharged from hospital and then go back to smoking again, because they're the purpose. So the community pharmacists are now, as part of an advanced scheme, are now reimbursed as well for supporting patients to stay stopped after they're discharged, which is great news.
Thank you. Excellent. Also a great example how community and hospital pharmacists can collaborate for the good of the health of the patient. So excellent. Professor Tan-Ching Xiang, you mentioned that in Malaysia you use a lot of behavioral sciences and also motivational support. Are you also using apps, for example, for keeping a continuous contact with the patient and support them in their smoking cessation activities?
Yeah. Okay, thank you, Lars, for the questions. And in Malaysia, the government is actually leveraging the MySejahtera apps that we have been heavily using during the COVID pandemic time. That every these Malaysians that they need to report their venues during the COVID pandemic, and through these apps, every Malaysians they have this registered to these MySejahtera apps, and those smokers or tobacco user that they tend to quit from smoking, and they will register through these MySejahtera apps. And from there, they will also collaborate with the M-Quick program, that it is actually a private and public collaboration that the smokers can choose their preference venues to receive this tobacco cessation services. Yeah.
Okay, thank you so very much. We have a question here from Indonesia. Indonesia hasn't ratified the WHO FCTC, and as such, they say it's harder to start an initiative, like mentioned in this webinar today, for example, in community pharmacy. Dongbo Fu, can you give your opinion on how to start the initiative in Indonesia, as they haven't actually yet ratified the FCTC?
Thank you. I think even they are not yet a party to WHO FCTC, they can still, I think, do many things to support tobacco use to quit. I know your country actually have some, several cessation services in place. I think the key is the same as other country, to try to use this service to help as large number of people as possible. In other words, to increase the reach of the existing cessation services For example, your country have a national toll-free line. I know there's some issue at this moment. The reach is very limited. Your country also have a lot things done in the healthcare system. For example, you have a tobacco training course, I think, developed. It's an online training course with WHO support. And in terms of try to engage in pharmacists, you can start from you. You can actually form a network starting from the place which you are working. To try to do something, then I think more people will follow you. And then just by your information, we are working with your Minister of Health. Soon we are going to have a meeting to develop a national tobacco cessation action plan. So under this action plan, I think all the health professionals can participate in to support the national event in terms of helping tobacco spread.
Thank you so very much for your answer. And linked to this, I will raise the question to Ines and Dalia at the same time. You can choose which one of you would like to answer first. But how can actually the resources now of FIP contribute to improve or enhance smoking cessation activities in different countries? For example, where we still don't have any activities. What are your thoughts on this?
Thanks, Lars. I'll start, Ines, very quickly. This is a great question. So whilst we are promoting the knowledge and the skills reference guides at a professional development tool, as I mentioned earlier, Lars, it could be used on individual levels. So our colleagues on the call that are perplexed a little bit by the disparity in practice models and interventions from around the world and probably wondering about where do we start. And you've already mentioned it, colleague, you can start on the individual level. Dr. Darush, you already mentioned, you said, the 30-second rule, possibilities of, saving someone's life. And I'm wondering whether we could all start on an individual level, whether we are starting in practice with ourselves and our pharmacy support teams, or if we are in academia and education institutions, we start teaching others, whether we are in teams where we can teach our peers and really starting with small projects to really highlight the benefit of promoting smoking cessation is a great way. But Lars, we also have examples where member organizations and FIP utilize FIP resources to develop programs that they can implement on a national level through their member organizations. So if you are one of those people that has a lead, has a hand in policy development, in professional development projects, please do share these resources because they are there for you to use. Now, we often say this at FIP, and I would like to reiterate, these resources are generic enough for you to take them and adopt and adapt them to your local and contextual needs and priorities. So do use them as a generic model, but also tailor it to your own needs, whether on an individual, professional, organizational, or national level. I hope that helps, Lars, in a nutshell, but I'll also hand over to my colleague, Ines, if she has any further reflections.
Thank you very much, Dalia, for the information. I think it's very important. But I want also to add that FIP are preparing a series of webinars targeted at specific audience such as Jordan and India, as these are examples of two countries with a very high rate of tobacco use. And in the coming months, you have new developments about our work in tobacco use. Please still connected with us.
Thank you both, Dalia and Ines. Excellent ways of sharing experiences and wisdom across the globe. I now see that time is running out, so I think I would like to see the next slide, Gonzalo. Well, I would like to take this opportunity to thank our fantastic panelists for their most valuable presentations, for sharing their experience and wisdom with us today, and for showing us the path to the future when it comes to smoking cessation. Thank you so very much for your most valuable contributions. I think it's always a good time to think about living a healthier life. And we have learned today that with the help of a healthcare professional, like the local pharmacist, the chances of successfully quitting smoking are much bigger. Pharmacists can provide education and can help find the right medications or remedies for smoking cessation. And FIP has developed some very useful tools for pharmacists. And they can also offer, of course, pharmacists can also offer expertise when discussing nicotine replacement, therapy and other medications that help with smoking cessation. The new handbook, developed in collaboration with an international group of experts from various organizations, including the WHO, outlines the latest evidence-based practices, techniques, and strategies for pharmacists to help people on the often challenging journey to a tobacco-free life and remaining abstinent, together with a accompanying knowledge and skills guide. The information contained in this handbook and guide is practical and tailored to the needs of the pharmacists. So by using these new resources from FIP, pharmacists can actually contribute to improving public health and reducing the large burden of tobacco use on our healthcare systems. And pharmacists play an even more critical role today in healthcare delivery. And the local pharmacy is a mainstay of the community, serving as a convenient, accessible destination for a wide range of healthcare services and wellness needs. And this includes smoking cessation. Quitting smoking is difficult. Not only it is a habit, but it is also physical addiction. And chances of becoming successful increase with the help and support of family, friends, and healthcare providers. The pharmacist is prepared and ready to help. So I would like all of you to advise your friends and colleagues to increase their chances of quitting smoking this year by go and see a pharmacist. I also advise you to join us at the 81st FIP World Congress of Pharmacy and Pharmaceutical Sciences in Brisbane. We will have a most exciting and attractive program, which you can find on our website. So please sign up for the Congress, and please note also as well that the early bird registration deadline is the 15th of June this year. And furthermore, next slide, please. I would like to highlight our pharmacy education journal. It's a fully open access, peer-reviewed journal that has been serving the domain of pharmacy education, workforce development, and associated field for over 20 years. And this journal is actually, I would say, top of the line today, where we can find the latest research when it comes to our changing healthcare environment and the new roles for pharmacy. So please have a look at the Pharmacy Education Journal. It will give you a lot of value. And furthermore, FIP is actually approving these guidelines in improving the quality of publications in and advancing the paradigms of clinical and social pharmacy practice research, what is called the Granada statements. So please also look into this, because it includes a number of valuable recommendations when it comes to the appropriate use of terminology in publishing, impactful abstracts, the required peer reviews, journal scattering, and use of the metrics wisely, and also by selecting the most appropriate pharmacy practice journal. So these are valuable tools for you when you would like to present your research. By this, I would like to thank all of you, our fantastic speakers, as well as you who have attended online, for being with us today. Smoking cessation is extremely important for making a healthier world and for improving the quality of life of our patients and our consumers. So please use the new tools and start to develop smoking cessation activities in your own country. And don't forget, FIP is here to support you whenever you need it. Thank you so very much. I wish you all a good day. Goodbye.